guys, welcome to Yogopathy. So today I want to talk to you about a very important topic, diabetes. And if you're watching this video, I'm pretty sure either you or your family members or loved ones has diabetes and you want to know more about it, want to understand the cause, what is the best way you can treat this. And that's why I'm making this video. I want to share with you all the information that I have read and collect it and put it in one place so that I can help you understand diabetes in a better way. So here's a typical scenario of how a diabetic patient is usually treated. So when you're diagnosed with diabetes, you'll be put on medications like metformin, sulfonylureas, meglitinides, DPP inhibitors, and there's so many other drugs. And if you're diagnosed with type 1, you'll be put on insulin. And other than the medications, you'll need to constantly monitor blood glucose level. Like if you're type 2 diabetic, you'll have to monitor it monthly, and if you're type 1, you'll have to check your blood glucose levels multiple times in a day. And not only that, you'll have to change your diet. You'll have to cut off on carbs, calories, and there's so many other things. So this is how a conventional treatment for a diabetic patient will look like. On top of that, you are at risk of a number of complications. Because your blood flows throughout your body and because the blood sugar levels are high, it can cause complications throughout the body. When the blood sugar is high, imagine it to be like a sugar syrup. Anywhere it goes, anywhere this blood goes, it's going to damage. It's going to cause damage to those tissues. So when this high viscosity blood goes to the vessel supplying the brain, it can cause stroke. It can damage the vessel supplying the brain. It damages the vessel supplying the eyes, and it causes retinopathy, and in some cases it can cause blindness. And when it damages the arteries supplying the heart, it can cause angina, heart pain, and it can even cause heart attack. And when it damages the fine artery supply in the nephrons of your kidney, known as glomeruli, it can cause kidney failure. It won't be able to filter your blood properly. So it's just a systemic problem, and it also damages your nerves because the arteries supplying your nerves, they become damaged, so the nerves start to die and degenerate, and it can cause loss of sensation. It can cause, because of this loss of sensation, you can have other infections, and also because your blood is high in sugar, you are more susceptible to bacterial and fungal infections. So this is not a good disease to have, and especially if it's not treated properly. And these complications can occur even though you're on medications. I've seen so many patients in the hospital who have been diagnosed with diabetes for years and years, and they have so many complications, like they're blind or they've got an infection in their leg. In some cases it leads to amputation. So we really clearly need to look for a better solution for diabetics. We need to get to the root of the cause. We need to understand this problem better, and that's why I'm making this video, so that you can get whatever information you need to know, empower you so that you can make your own decision about diabetes and how you want to treat your diabetes. All that sounds really scary, right? But you don't need to be scared. If you have diabetes, you can heal it. You can reverse your diabetes, and just by changing your diet. That's why I'm making this video, so you can learn and understand about your disease, and you can be empowered to make your own decision and see if you want to try changing your diet, and at least try it out. Change your diet. Try. It may take, some people, they can reverse their diabetes within a few days. Some people, if it's a chronic case of diabetes, it may take 1 to 3 months, but you surely will get better if you follow this diet. So let's get into the video.
Here's a study showing the effectiveness of a high nutrient density diet on the glycemic control of type 2 diabetic patients. 13 adults, both men and women, were included in this trial. The diet comprised of unlimited greens and vegetables. Beans, peas, lentils, and whole grains were permitted, and the primary fat source was nuts and seeds. Basic recommendations were 1 large green salad a day, 1 bowl of vegetable bean soup, 1 to 2 ounces, that is 1 to 2 handfuls of raw seeds and nuts, 3 to 4 fresh fruits, 1 large serving of steamed vegetables, 1 serving of whole grain starch such as steel cut oats and brown rice, no white refined flour, refined sugar, and no oils were allowed. Now let's look at the results. Let's see what happens to A1C levels in the blood, which is one of the best measures for blood glucose levels. As you can see, all the patients have an A1C level more than 6, which means they are diabetic. A normal A1C level is less than 6. Most of the patients have an A1C level more than 7, which is uncontrolled diabetes. The American Diabetic Association recommends to bring down the A1C level at least down to 7 in diabetics. The results show a mean drop of A1C level from 8.2% to 5.8%. That is, they went from being uncontrolled diabetics to non-diabetics in just 7 months. 62% of the participants reached normal A1C levels. What's even more remarkable is the mean drop in medications was from 4 to 1. And yes, this was a pilot study with no control group, but the magnitude of the effect makes it undeniable that a high nutrient density vegan diet can reverse your diabetes. Now, for the big question, what causes diabetes? The answer to this is insulin resistance.
Now let's try to understand what exactly is insulin resistance. Now, when your food is ingested, it goes to your stomach and intestines, it's digested and broken down into glucose. And glucose is absorbed into the blood and distributed throughout the body. Now, when the blood glucose level rises, it sends a signal to the pancreas, the beta cells of the pancreas, and the pancreas then releases insulin into the blood. Now, this insulin is necessary for certain tissues in your body, such as the liver, adipose tissue, and muscles, to utilize this glucose in your blood. So what happens in insulin resistance is your pancreas secretes the normal amount of insulin into your blood. But for some reason, your insulin does not act the way it should. It does not respond to the receptors in the insulin-dependent cells the way it should. So the glucose in your blood is not able to enter these insulin-dependent tissues. So that's why your blood glucose level remains high even though there's normal amount of insulin being secreted. So let me try explaining this with an example. Suppose a normal person requires just 5 units of insulin to make X amount of glucose enter your cells. In case of a diabetic person, they may require 10 units of insulin to make the same X amount of glucose enter your cells. And with time, this actually exhausts your pancreas because it becomes overburdened. It has to secrete double or triple the amount of insulin into your blood. So eventually with time, your pancreas can burn out and stop working and stop producing insulin at all. So let's imagine insulin is the key and my hand is the receptor on the surface of the cell. So in case of insulin resistance, for some reason this key, the insulin key, is not able to open the door of this receptor and allow glucose to flow in. So there can be two things that have gone wrong. Either this key, this insulin key, is deformed for some reason, which is not able to open this door, or either this door, this receptor has gotten deformed and that's why this key is not working. So now I'll try and explain these two theories in detail.
Now, the first theory to explain insulin resistance is a defective insulin receptor. The reason that this can happen is fat. Scientists have hypothesized that there may be globules of fat inside the cell that actually block the receptors that insulin opens. This in turn interferes with the ability of insulin to signal glucose to come in. Let me explain this more simply with an example. Imagine if someone put chewing gum inside the lock of your house and you tried to open it with your keys. It wouldn't open. This is exactly what happens in an insulin-resistant cell. The cell stuffs intracellular fat deposits into the insulin receptor, making it impossible for the insulin key to open the insulin receptor door. This theory explains why overweight or obese diabetics may have insulin resistance. But it fails to explain why thin and skinny people develop insulin resistance, because it's unlikely that they have intracellular fat deposits as well. And hopefully the next theory will explain this. The second theory to explain insulin resistance is defective insulin.
So when you consume a high-fat meal, the first step is digesting the fat. And this is done by the pancreas, liver, and the adrenal glands. The pancreas releases lipases to digest this fat, the liver releases bile salts to digest this fat, and the adrenal glands actually secretes a hormone called adrenaline, which is actually a fear-based hormone, into the bloodstream. And the role of adrenaline is to help in increase the digestive strength to digest the fat, and also to help move the fat through the system. Now, once the food is digested, the blood glucose level rises. And this stimulates the pancreas to secrete insulin into the bloodstream. So now we have adrenaline and insulin in the bloodstream. Now let's see the effect of these two hormones on the blood sugar level. Adrenaline is responsible for increasing the blood sugar levels, and insulin is responsible for decreasing the blood glucose levels. This means adrenaline keeps the glucose in the blood, and insulin is responsible for moving the glucose in the blood into the cell. So when you eat a high-fat meal, the pancreas releases insulin, and this insulin mixes in the bloodstream with adrenaline, and your body starts to associate insulin with adrenaline. With time, your body starts to shun the combination of adrenaline and insulin in your blood. It starts to become allergic to these hormones, and it starts to become unresponsive to insulin. This leads to insulin resistance. So you can imagine your adrenal glands as a fire station, and a high-fat meal is nothing but an alarm bell which triggers the adrenal gland to release adrenaline into the blood. So another trigger that can cause the adrenal gland to release adrenaline is negative emotions. This can be in the form of, like, if you've lost someone you love, or depression, anger, hatred, any negative emotions which you hold back. This can be really damaging to the body, and this causes a release of adrenaline into the bloodstream. To quickly summarize this, when you have a high-fat meal, your pancreas, liver, and adrenal gland are overworked to digest this fat. Your adrenal glands release adrenaline into the blood, and adrenaline helps in increasing the digestive strength and moving the fat through the system. Once the meal is digested, your blood glucose level rises, and this in turn triggers the pancreas to release insulin. And once insulin is released, adrenaline and insulin in the blood actually mix in the blood. With time, this makes the body unresponsive to insulin, leading to high blood glucose levels and insulin resistance. So the fastest way to address insulin resistance and to heal yourself is to get to the core of the problem. There are three main important things which you have to look at. Number one is the high-fat diet. Number two is negative emotions. And number three is to help heal the damaged, overworked pancreas, liver, and adrenal glands. So this is completely in your hand, a high-fat meal. All you need to do is decrease the amount of fat in your diet and increase the consumption of fruits and vegetables. And by decreasing fat in your diet, I mean eliminating all animal products like meat, dairy, refined oils, vegetable oils, and for negative emotions, you can try yoga and meditation. For healing your damaged and overworked pancreas, liver, and adrenal gland, you can follow the 28-day clean. That's probably the fastest and most effective way to heal your already damaged pancreas, liver, and adrenal glands.
Now, if fat is the problem, what if you eliminated fat from your diet completely? Such a study was done on 99 diabetic patients. Half of them were given a low-fat vegan diet. This meant two things: keeping off of animal products and keeping vegetable oils on low. There was no counting calories, no quantity limitations, and no counting carb grams. On the other hand, the other half of the patients were put on a diet prescribed by the American Diabetic Association. This meant counting calorie intake and counting carbohydrate intake. Results after 22 weeks showed that 43% of the patients in the vegan group showed reduced diabetic medications, almost double the number in the other group of patients. The HbA1c levels decreased by 0.96 percentage points in the vegan group as compared to just 0.56 points in the ADA group. The mean decrease in body weight was 6.5 kgs in the vegan group, more than double of the weight loss in the ADA group. The LDL cholesterol fell by 21.2% in the vegan group. Again, this is double of the fall seen in the ADA group. The improvements seen were far greater with the low-fat vegan diet. This was published and recognized by the American Diabetic Association. Remember that there are numerous studies and patients who have reversed their diabetes by following a whole food plant-based diet and a high nutrient density diet. You don't need to count carbs or calories or restrict quantity. I for sure can't stay without my dosa and idli and wouldn't want you to miss on it too. Stay happy, stay healthy, and stay blessed.